time at the patient roundtable, and we thought we'd bring this group of people together to really talk about the patient perspective in relation to the summit and the sorts of things that we should be thinking about. So I'm very pleased to have this group together, and I thank them for their time, and also thank Janelle Bowden, who has helped us coordinate it. So I think you'll find this very, very interesting.
So hi everyone, we're talking COVID and the impact on healthcare, and I'm here with Penelope and Rosemary. How willing do you think you guys will be to get a COVID vaccine when it comes along, and what do you think would improve that willingness?
The decision to vaccinate or not vaccinate is something that I've found in the chronic illness community is actually right near the top of people's minds. Am I willing to take it? That's what this question is.
Yeah.
And under what circumstances would I be willing to take it? People are concerned about the length of time for phase 3 trials, that the long-term follow-up is, of course, being accelerated, and that makes them anxious. People want greater transparency about the trials, about the details, so that if they are well informed, they can dig down into the trials and make a personal decision. The biggest concern overall is distrust of the cohorts. So saying, where's the trials that include people with multiple comorbidities? Where's the trials for people with autoimmune conditions? What about other people whose immune system is over-functioning or under-functioning? We know that the virus itself kills people through the immune system. You get a cytokine storm. The immune system is an issue with the illness. So how are these vaccinations going to interact with people who have dysfunctional immune systems? Some people have said, and I'd certainly be in this category, they'd be willing to be vaccinated if someone collected the data, that if they take that risk, because of their health condition, it is a risk. If they take that risk, they want that to contribute to medical science so that other people in similar situations have better information.
My experience follows on perfectly because I have 2 autoimmune conditions. I've got rheumatoid arthritis and ankylosing spondylitis, which is another form of autoimmune arthritis. I also have type 2 diabetes and fibromyalgia. And so people like us often do have multiple things going on. And as Penelope said, that most often these clinical trials are done on healthy people, or maybe one specific condition rather than multiple conditions. So that is one concern. And I agree also that as a general rule, I love the idea of vaccines, and I get my flu vax every year, sometimes twice a year if I need a booster. So I think it's a very vital thing. But again, because I've got autoimmune conditions, there are actually some vaccines that I can't take. So I was actually reading more into this. My initial reaction was, yes, give me a vaccine as soon as it's proven to be safe and ready, and I will have it. And then I realized that one of the medications I take is to suppress, several of the medications suppress my immune system. And one is in a category called a TNF inhibitor. So that actually calms the immune system down from being overreactive. Now, one of the things I learnt was the London vaccine that's being developed is actually a live vaccine, which actually uses a weakened form of the actual pathogen. TNF is a part of the immune system, so to boost that part of the immune system to fight the coronavirus. But in my case, and many other people's cases, we don't want this boosted because that's going to make our conditions worse. So the alternatives would be that we would have to go off our medications to actually then take the vaccine, or there are other vaccines being developed that have, because there's different types of vaccines. And so there are some that we can take, for example, the flu vax, so we can take that. But at the moment, I can't take the measles vaccine, the shingles vaccine, and quite a few others. So it's going to be weighing up to see, okay, first of all, is it safe? So generally, is it going to cause problems for my conditions if I do take it? And is it something that I can even take in the first place? So that's a big eye opener. So there's lots of questions that are yet to be answered. And if a vaccine is found and funded by our government, it would need to be very much the education campaign that goes with it would need to tell people like me and other women whether or not you can or can't take it.
For the rest of the panel, how willing do you think you would be to get a COVID-19 vaccine, and what do you think would improve that willingness?
I'm keeping a close eye on the research and what vaccines are likely to come up, and whether they're live or not. It's not always easy to get that information, but I guess, as has been stated, it would be good if when it finally gets to that point, that the government tries to educate everyone on that sort of information. And yes, I would be keeping close contact with my clinicians to get the accurate information.
Access to information has become really important during this time, and I think the government's done a really great job at providing community education, but I think a lot of people in the chronic illness community have struggled finding specific information for their community, and I think that this falls into line with that. And I think in some cases, because teams and healthcare professionals have been so inundated, maybe not necessarily with patients, but just having to constantly review protocols and look at how things are changing within the system, that they may not have always been available to share information with their patient cohorts, or there's, you know, all kinds of restrictions about clinics and things sharing information. And I think that that's something that the chronic illness community has really craved, that information, and not just broad information, but specific information for their condition. And I know there are limitations around that. There's still so much we don't know about COVID, but I think that what they do know and what they do have access to, and even if that's just telling the community, look, we don't know, that line of communication is really, really important at this time.